My name is Dr. Michael Hewson, and I'm the consultant pathologist here at Shorish Laboratory. And one of our main jobs is to provide support for cancer diagnosis for HeWa Hospital, which brings us into World Cancer Day. And this is one of our main jobs here at Shorish is to diagnose and help the clinicians in the treatment of different types of cancer. Now, you ask a question about what is cancer, and it's an excellent question because cancer is common. Cancer is going to affect 1/3 of everybody that's alive in our community. Okay? So you can count, if you live long enough, you're very likely to have cancer. And cancer is a growth of cells, an uncontrolled growth of cells that results from genetic alterations causing mutations in cells that then develop into a tumor that can spread to different parts of the body. Okay? And what we call cancer is a growth of these cells that spreads from one place to the other. That's kind of the definition of cancer. Now, there's a large number of different types of cancers. Some of them are rare. Some of them are actually very common. In our community, the most common of all the cancer is going to be breast cancer in women. In men, probably lung cancer is our most common cancer, or prostate cancer is probably going to be the more common of the two. Now, one of the things about cancer is that we think of cancer, if we get a diagnosis of cancer, that it's going to cause the death of the patient. And that's not necessarily true, because many types of cancer are very treatable. Breast cancer and prostate cancer are two examples that most of the people that have a diagnosis of either breast cancer or prostate cancer are not going to die of their cancer. Okay? They can be effectively treated, and the majority of people will survive their cancer and die of other things. There's always a question about the etiology of cancer, what causes the cancer. Now, for most of our cancers, we don't know what causes the cancer. It's just unknown. So there's not any steps that you can take to prevent the cancer. It's basically bad luck. Okay? That somebody would get cancer and another person would not get cancer. There are some cancers, and they're not very many, that have a known cause. Now, approximately 10% of all cancer arises because somebody inherits a abnormality in a gene from a parent. From one of the parents, it gets passed to the child, and the child inherits a risk of developing a certain type of cancer. The two cancers where this is particularly common is going to be colon cancer and breast cancer. Okay. About 10%. That's not a large number, but 10% of all individuals that can develop their cancer on the basis of an inheritance from one of the parents. Okay. Let's see. Most common cancer in men, it's going to be prostate cancer. In women, it's going to be breast cancer. Prevention. Now, in some cancers, and this is important, there are ways of preventing cancer. The cancer with the worst risk to a patient is going to be lung cancer. And 80% of all lung cancer is preventable. You just stop smoking. Okay? Smoking is the cause of at least 80% of all lung cancer. And it can be prevented by stopping smoking. A man has been smoking for 20 years. If he stops, say he started when he was a teenager, he's 45. If he stops, in 10 years, his risk of developing cancer will go back to normal. Okay? But it takes about 10 years for that risk to diminish back to normal. The best thing is not to start smoking at all. So if you have a child growing up and thinks he wants to start smoking, you want to discourage him from smoking. And one of the major reasons for not smoking would be the development of lung cancer. There's other diseases that are just as important that smoking causes, such as cardiac disease and lung disease. Okay? But the one we think of as being particularly important is going to be lung cancer. Treatment. We have very effective treatment for many of our cancers, and at Hiwa Hospital we have an institution that's devoted to applying these treatment regimens for people with cancer. Take breast cancer. If a person has a diagnosis of cancer, they need a surgeon. At Hiwa, they work in conjunction with surgeons in the town to develop the best treatment plan that they can, and they work together. They have boards where they discuss the patient and their plan for treating the patient. So after the surgical treatment, then they have to decide on whether the patient is going to get some type of chemotherapy, and that depends on the pathologist, because we do testing for different types of markers to determine whether they can be treated with, say, a relatively innocuous drug called tamoxifen or an aromatase inhibitor that really doesn't have much adverse effect on the patient at all. And most cancers, most breast cancers, are going to be treated by some level of tamoxifen treatment, and it's an anti-estrogen that prevents the cells from growing. But some of the cancers are going to have to be treated with chemotherapy, and this is the decision that has to be made in conjunction with looking at tumor markers that are done in pathology and talking with the pathologist about how aggressive the tumor appears, and then by also bringing into consideration how big the tumor is and whether it's spread to local lymph nodes, and then they decide on whether the patient needs chemotherapy and the type of chemotherapy. All of the different tumor systems have this approach to their treatment. Some tumors need to have radiation therapy, and this is generally done in conjunction with the board of people that develop a treatment plan for that patient. We talk about prevention. The main thing about prevention is don't smoke cigarettes. Okay. Well, the predominant cancers in Kurdistan are going to be breast cancer in women and prostate cancer in men. Lung cancer we see with fair frequency, and it's probably underdiagnosed. It's difficult to diagnose lung cancer in many cases because it involves invasive procedures, and we really have a limited number of doctors that are capable of doing the type of thoracic procedures. The group's from Suleimani Polytechnical University, and they have the name of Bright in the Darkness, and I appreciate the opportunity to talk to you and discuss these very important issues on today that's World Cancer Day.